So if we can get young people, I guess, to look for help earlier, then it means that they're not struggling for months and years sometimes with a mental health challenge that actually might start quite small potentially, but because it's left and because it's not dealt with, it tends to grow and evolve and get bigger. We did some research a number of years ago, and I suppose that a lot of the international research would tell us that 75% of adult mental health diagnoses of mental health difficulties actually begin in childhood, and begin in adolescence. So if we can, I suppose, through our early intervention and prevention piece, along with our community partners, if we can encourage young people, get help when a small bit of help will do. It's better for them, it's better for the community, for the school, for the family. It's also better for us as a society, So
I suppose Jigsaw Limerick is one of 12 services now in Ireland, Jigsaw services. It originated in 2006 with Dr. Tony Bates, who was charged with examining the whole mental health provision in Ireland. He worked as a clinical psychologist for 25 years in Dublin. And I suppose one of the things he noticed all the way along really was that the mental health services weren't really geared towards engaging young people. They were very good maybe for older adults or for adults, but less so for young people. Jigsaw nationally, we've met over 25,000 young people in the 10 years that the services have been going. The satisfaction rating, when we asked young people and their parents afterwards, are very high. But it's our sense in the room when you're actually working with a young person who you see them kind of emerging from, a place where they feel lost, they feel isolated, they feel alone, they feel different, and that they're maybe the only ones struggling with this or there's something wrong with them, to actually normalise that experience and say, well, actually, you're very like an awful lot of other young people. But that's not to dismiss what you're saying or what you're bringing here. But what you're experiencing isn't something wrong with you. It's a normal reaction to a situation that isn't normal for you. Young people are centrally involved, so we have a youth advisory panel in each of the Jigsaw services around the country, and also in national office. These offices here were picked by young people. It was designed and decorated by young people. They chose all the furniture. They went to IKEA and bought all the furniture. And they help us and inform us about the kind of work that we should do. Again, we start at the very basic level of a young person who is beginning to experience challenges to their mental health. And frequently that'll be a young person maybe in secondary school, and maybe they're experiencing exam stress or difficulty in the school placement. Maybe there's issues going on at home, challenges there. Maybe it's experiences of bullying, poor self-confidence and self-esteem. So the issue is beginning to emerge. But each individual is different. We all have our own mental health strengths, which we cope with very well, and our own challenges, and vulnerabilities. So something that might affect you or me in a way that you would take it in your stride. So it's important that each individual kind of is able to and supported to deal with their own mental health and have support for that. What we find, I have found over the first year and a bit, it's really anxiety and stress related to school performance, anxiety related to exams. That is a big component, and general life anxiety as well. So anxiety is about 40% of the work that we do here. And then difficulties maybe at home in relationships with parents, which is not untypical of us in our teenage years. There's the natural kind of growing away from parents and growing towards peer groups that can raise challenges. I want to very quickly say social media has an awful lot of positive aspects to it, and young people are very quick to tell us that, it's an important part of their life. It's their connectedness with their friends, with the world, connectedness with interests that they have and groups that they follow and whatnot. So that's really important, and it's here to stay, and we need to positively kind of interact with it. But they do also say that it does provide them with challenges, and particularly around cyberbullying and the on all the time kind of element to it. So I think it's about maybe engaging with young people and asking them, well, how can we help to make this experience of social media a better, a more positive, a more healthy experience for you?
you know, and how do we limit then and minimise the negative impacts of that experience. I think, you know, that's one for the whole community, but certainly we're really interested in doing it.
Perfect.
There's 7 billion people in this world, and I'm sure every one of them has a different menu of things that helps their mental health, but let us all have that menu. Let us all have those things that help us. You know, and that really, ultimately, if we're doing something every day that helps to promote our mental health. We talk about the 5 a day for mental health, and that's come from very strong research, you know, that we ought to be doing 5 things a day, a bit like the 5 a day for vegetables and fruit. We ought to be doing 5 things a day, you know, and that's connecting with people and taking notice of the world around us, getting active, giving back is very important as well. That experience of volunteering or helping, whether it's making a cup of tea for mum at home or helping out with the football club or the younger players or cubs or beavers or whatever it is, that actually is very helpful.